And the short answer is yes, but I like to unpackage that a little bit. First of all, most people, when they say birth control, they're thinking about birth control pills. And so that's what I'm going to talk about mostly. But there's also IUDs, there's the arm implant Nexplanon, there's Depo-Provera, there's lots of different kinds of birth control. And this is really true of any of the birth control methods. But birth control pills, I really wanted to talk about. So some of the issues really have to do with why are you on the birth control pills. So if you're on the birth control pills to prevent pregnancy, then you really want to continue those birth control pills when you're on hormone replacement therapy, because hormone replacement therapy does not provide contraception. If you're on birth control pills because otherwise you have really bad periods, probably still good to stay on those, because hormone replacement therapy, in the way Winona prescribes them, shouldn't really affect your periods, either better or worse. And so if without the birth control pills you get bad periods, you may want to continue them. The last category is sort of unfortunate, and honestly, there's some lazy OB/GYN doctors that just put people on birth control pills for everything. And it's a really kind of not so good way of doing hormone replacement therapy. Birth control pills have synthetic hormones. They don't work as well as hormone replacement therapy, and they won't get all your symptoms resolved like traditional or particularly bioidentical hormone replacement therapy does. Furthermore, the dose is really high compared to what we use with our bioidentical hormone replacement therapy at Winona. And so you're really exposing yourself to a lot more side effects and a lot more risk. So if the reason you're on birth control pills is because you have a lazy doctor that did that for just stay on your pills and you'll be fine, you're really going to be much better off stopping the pills and just using the hormone replacement therapy, the bioidentical hormones that Winona prescribes. The interesting thing now is, so what about being on both? So let's say that you need contraception and you're on birth control pills and you're happy with that, but you're still having these symptoms of the menopause transition. You're still having hot flashes, night sweats, you can't sleep, you're gaining weight, all these things that hormone replacement therapy can help with. The birth control pills really work by completely overwhelming the system. They shut the ovary down and they take complete control over your female hormones. And that's great for preventing pregnancy. It's really good for cycle control. Not so good for symptoms of menopause or the menopause transition, because these hormones in birth control pills are not bioidentical. They're synthetic and they have side effects, and they don't affect the receptors the same way the bioidentical hormones do. And so sometimes if you're on birth control pills for birth control, and we add hormone replacement therapy, those bioidentical hormones can act differently on those receptors and fill in the gap and pick up and solve those symptoms that the birth control pills aren't solving. The amount of hormone that it increases compared to the hormone exposure on birth control pills aren't enough to really be an issue. So it doesn't really increase your risk of anything particularly, although honestly, birth control pills have much higher risk than hormone replacement therapy. So if you're able to get rid of the birth control pills and just use the hormone replacement therapy, you will decrease your overall risk. But it's safe to be on both. And for a lot of women, I've had a lot of success of women that are on birth control pills, still having symptoms. We add in some bioidentical hormone replacement therapy, and that knocks out those symptoms that birth control pills are missing, and they really feel better, but they still get the birth control benefit from the pills. So that's a very safe and reasonable way to do it. So again, is it okay to be on birth control and hormone replacement therapy? The answer is yes. Is that the best way to do it? Maybe. It depends on what your needs are.